Well, hello everyone, and welcome to our info session on health informatics and health services management, two certificates. My name is Mushur Chaudhry, and I'm the manager of recruitment and sales for the Chang School. Before we get started, I'd like to acknowledge the land on which Toronto Metropolitan University is built upon. Toronto is in the Dish with One Spoon territory. The Dish with One Spoon is a treaty between the Anishinaabe, Mississaugas, and Haudenosaunee that bound them to share the territory and protect the land. I thank the indigenous peoples of Turtle Island for their efforts to protect the land, and I deeply regret the past injustices they have endured. As Toronto Metropolitan University seeks to move forward in partnership with Indigenous people, I pledge to foster an environment that is more inclusive and welcoming of Indigenous peoples from all communities. Now, I'd like to go over a few items so you know how to participate in today's session. Your microphone is muted throughout the event so as not to disturb other attendees or the presenters. For the hearing impaired, we have automated captioning available, which you can access by activating it in the toolbar at the bottom of your screen. And you can submit questions for our speakers at any time by typing them into the question box of the control panel. We'll collect them throughout the session and address them at the end of the presentation during the Q&A portion. Now, I'd like to introduce our guests for today. First, we have Dr. Priya Nipak, Professor and Interim Director of the School of Health Services Management, and also the Associate Professor and Academic Coordinator of the certificate. And we have two industry experts joining us. One of them is also a previous student of the certificate, Abbas Zafar and Lisa McKenzie, and I'll be introducing them more formally soon after the presentation. But we first wanted to invite you to do a quick poll with us. We wanted to check the temperature and see where we are in the room. So we'd like you to join us at menti.com. If you can just open up your browser really quickly and enter menti.com and use the code 38936818. And yeah, it'll just take a few seconds to do this quick poll. It'll provide some context to our speakers and panelists, and it'll provide some really good feedback to our team. So the first question, as you can see, is what motivated you to consider the certificate? And we've got a few options there. There's career advancement, that's the first one, career change, skill building for current role, personal interest, and others. So you'll see as you enter your selection, it'll come in live and we can see what your votes are. And yeah, it looks like we've got career advancement and career change leading the way with skill building for current role as just one following behind it, and personal interest. We've got one personal interest, so I guess that's good. We'll leave that on for just a few more seconds, and then there's just one more poll that we want to take to test the temperature of the room, and then we'll get started. Yeah, so we started using the menti.com as a tool this time around. It just provides a little more interactive live polling, and we wanted to use that tool. So yeah, it's been great. Okay, so next question is, what is your current level of knowledge in the field? So we've got three options. One is high, I'm well informed about the field, moderate, basic awareness, and then low, minimal, or no prior knowledge, which is totally fine as well. So yeah, love to see a lot of people with other backgrounds. Okay, so we'll leave that on for just a few more seconds, and then we will end the poll and get to our presentation from Dr. Priyanapak. Okay, so yeah, a really high percentage with minimal or no prior knowledge, then moderate, and a couple of people that are well informed about the field, which is good to see. All right, so Luke, I'll stop sharing. Back to you, and we can go ahead and invite Dr. Priya Napik, Associate Professor, Interim Director of the School of Health Services Management, and also Academic Coordinator of the Certificate at the Chang School. Welcome, Priya.
Hi, welcome everybody. I'm just here to tell you a little bit about the Health Informatics and Health Services Management Certificate. So thank you for joining us today. And let's slip into the first slide. Thanks. So just some quick facts about the Health Informatics and Health Services Management Certificates. They are both 7-course certificates. They're both delivered entirely online. The length can vary between the Health Informatics Certificate and Health Services Management Certificate, but both of them can be done in about a year's time. The cost varies slightly, but it's kind of in the same range of $4,100 to about $5,300, depending on the elective courses that you take, because you have required courses, and then it's the elective options that will cause the range to vary somewhat. So, yeah. So there are obviously a number of industry trends associated with both certificates. Health informatics, many of you would know, I mean, even with the evolution of and use of artificial intelligence, is quickly evolving into a field that is definitely utilizing those tools, maximizing them within the field. Uh, Health informatics specifically requires a foundational knowledge base in IT and obviously as well in healthcare because it's the intersection of the two. And obviously, it would help students enormously if they had some management background as well too. And through the certificate, you're going to learn some of the basics, but data analytics is an area that you would want to be very sophisticated in and grow your skill sets as well as policy, privacy, and security all are very relevant in the field. With the increased privatization of healthcare, it's also quickly aligning with greater need for health services management and health information management professionals in the field, of which both the certificate in health informatics and the health services management certificate cover some of the key issues around the role of privatization and the impacts on those sectors as a result of privatization. So some of the applications more specifically for the health informatics certificate, which you can see on your left side, and those in the Health Services Management Certificate on your right side are around areas of AI applications to predict and prevent disease. As I said, data analytics, cybersecurity, interoperability is a very growing area of health informatics, and Abbas can speak to this more fully in a moment. Genomics has been an ever-evolving area, as well as virtual reality. Some of the applications in health services management are around policy, like I identified, accreditation, which is something that happens on cycles repeatedly, evaluation, quality improvement, human resources, because you're dealing with people, and then financial management and ethics as well continue to be current and relevant topics that will be covered in the Health and Services Management Certificate. So we can just go to the next. I think that what's most important, if you're thinking about a career shift and you'd like to know what it is you're going to learn and how that would be relevant to working in those sectors, given that these are areas that are focused. So some of the foundational learning, or let's put it this way, some of the learning that you'll cover is foundational concepts and applications in the field. And so that will be, health informatics related foundational applications and health services management, depending on which of the two that you select. Towards the left, it's more focused on, again, health informatics. So computers and networks, that is something that you're going to cover very early on in our foundations course. Information systems and designs, there's a couple of courses that you're going to see these aspects covered. Interoperability, we have an entire course dedicated to it. Human factor impact as well, we also have a course dedicated to that. Information systems in hospitals and community care, you'll cover that across at least 2 courses. And virtual care. That again is in our foundations course and one additional course. So with respect to the health services management certificate, some of the stuff that you're seeing on the right will be covered and those will be the area of focus. So consumer and public health informatics, healthcare systems, electronic health records, you'll see across both certificates. Machine learning and AI, again, you'll cover applications in both certificates. trends in the field, management principles, human resources management, as mentioned earlier, ethics, privacy, and security. So quite a lot. So I think this is most important. So with all that learning, what are the career path options? Towards the left, you'll see those related to health informatics. So these are actual job titles that are searchable, like decision support analyst, clinical informatics analyst, clinical informatics specialist, quality improvement specialist, health informatics analyst, health data analyst, medical informatics analyst, and analytics managers. So I think you can get from the health informatics pathway that there's a lot of analytics involved. And so it's using that healthcare data to make management decisions through a series of different types of analyses so that we can have decisions that are informed by the data. Whereas the health services management certificate, you'll see titles that are quite varied, but also senior leader types of titles like executive director, mental health lead, operations managers, healthcare managers, patient safety consultants and managers. There's quality improvement managers, screening managers. So basically every clinical area will have management roles to oversee those particular functions within those environments. Yeah, so I think we can head to, I think, what's our last slide. These are some learner benefits, just holistically when you register for one of our certificates. These are some of the available services and supports that you will have at your disposal. I think Mashur can talk to you some of the more specific learner benefits, but career advising is one that definitely, as soon as you're enrolled in a certificate and upon completion, you'll have opportunities for career support and advisement, professional development support. You'll have opportunities with specific networking events. Obviously, the collaboration that you have in the classroom with your students while being virtual, it is quite collaborative still, making industry connections, creating a student community. There are, let's put it this way, I think we have 2 networking functions per year. Mashroor can correct me if I'm wrong, but the Chang School does have specific networking opportunities for those in this particular space of health informatics. Flexible learning, which is the greatest benefit that I find students report repeatedly, that they can learn on their own time. There are synchronous components built into our courses as well as asynchronous components, which allows students to be able to participate as groups and then individually working at their time to work around their busy schedules. All of our courses are offered if there is a virtual synchronous lecture in the course will be offered after hours, so between 6 and 9 p.m. And that's Monday to Thursdays. So you also have full access to TMU resources and all other learner privileges and access to financial supports like OSAP, awards, and bursaries. So these all become available to you once you become certificate students in either the Health Informatics Certificate, Health Services Management Certificate, or any other certificate at the Chang School. So yeah.
Awesome. Thank you so much for that really insightful overview, Priya. This was really helpful. Now it's my pleasure to introduce our next speaker, Lisa McKenzie, Director of Canadian College of Health Information Management and a passionate advocate and champion of health information management professionals. And I would like to welcome Lisa to share a couple of minutes about her experience.
So much, Mishra. It's great to join you all and see such a great bunch of folks interested in health informatics and health service management. It's definitely a growing field, as Priya has outlined for sure. We're seeing more and more interoperability and digital health platforms out there. We definitely need folks working in the industry who have got the skills and the competencies that are required for continuing that growth in the industry. So definitely an area of interest of mine. In my current role, we are the regulatory body for health information management professionals across Canada. And we definitely see the intersection between health information management and the informatics roles. And there's quite often a very large overlap between the two areas. So great to see that there's lots of folks interested here. I'm also a proud TMU alumni. I completed the Bachelor of Health Information or Health Bachelor of Health Administration a couple of years ago. Sorry, the name changed a couple of times as I was going through the program. So that's it for me, and I'll hand it back to you, Mesh. Thanks.
Thank you so much for sharing that, and it's a pleasure having you join us and share a little bit of your knowledge here. Now, I'd like to introduce our next guest speaker, who's also teaching one of the courses on health informatics, Dr. Abbas Zafar. Abbas is a physician and a digital health leader with over 20 years of experience in clinical practice, health informatics, and digital health transformation. And he holds an MD, an MPH, and a master's in health informatics from U of T, and specializing in augmented intelligence, clinical decision support systems, and also a strong advocate for personalized medicine. He's also a research and a practitioner and is using personalized medicine in the ecosystem with AI, machine learning, predictive analytics, and clinical business intelligence. So, welcome, Abbas, if you can share a little bit about your experience and your journey. And thank you for joining us.
Yeah, sure. Hello, everyone. It's nice to meet you all. It seems that over 85 people interested and joined to this event. I have been in the same shoes almost 6 years, 7 years ago, but it was in person one, and it was my pleasure. For the first time, I met Priya in the same opening session for this program, and she was one of those people to push me to choose this pathway as alternative pathway. So now I'm advocating the same thing as I selected this way for my as alternative. I'm physician and working in psychiatry and mental health for years. But I realized before to come to Canada, I realized that our healthcare system is transforming to digitization. So after I came to Canada, I saw that I can make it happen, my visions and my ideas in healthcare system through health informatics, health information management, digital health. As Lisa mentioned, they have lots of overlap. And this is that our healthcare system is moving in that way. And as you saw, it's a very growing market. Even in the pandemic time, all those other markets is crashed except health informatics or digital health. So this is our future, and it's a welcoming field for everybody with different background, not only coder, programmer, digital guys, or physicians, nurses, dentists, managers, everyone, because this is a very broad field and they need everybody to join to health informatics or digital health environment and improve the system. Back to you, Mash.
Awesome. Thank you so much for sharing that. Yeah, we already have a few questions that already came in, and we'd love to dive right into that. We'll start our Q&A. Everyone, please enter your questions into the chat. So I know there were a few questions about registration and transfer, and which were answered. So thank you, Abby and Raymond, for answering those. Another question that we have is, um, are there any prerequisites for the program if we have already completed our education outside Canada? So Priya, maybe you can share. As far as I know, as long as you are permanent resident or Canadian citizen, you can apply, right?
That's right. Yep, that's right. Those are both correct. So there's no prerequisites
Yeah.
requirements beyond that for eligibility into the certificate. One thing we do encourage is that people have experience working in the healthcare sector. So that's strongly encouraged, as I guess you could consider that a prerequisite requirement. So
Awesome. Perfect. And I know there are some questions about admissions and OSAP eligibility. So we're going to share my direct email address after the session is done, and you can contact me directly, and I can help you with all of that. But are there any collaboration opportunities or placement opportunities or anything related to that that people can expect? Maybe connecting with industry leaders and things like that.
So we do have those networking events that I mentioned, but in terms of the actual certificate, other than having guest speakers into the classroom, there are videos, but in terms of the interactive practicum placement opportunity, we do not have any of those in our certificate programs. We do offer, as Lisa said, and she's a graduate, our Bachelor's of Health Administration program does have a practicum that will run an 8-month period of time. And so that is essentially where you would get that actual placement hands-on experience. And not to mention the fact that you are in a classroom with peers that will be working, many of them will be working in various different healthcare fields and roles. So there is tons of opportunity to collaborate with your peers and network in that regard, because almost every single course has group work responsibilities. So I think I can echo that. Abbas also teaches one course and will be teaching another course in our program, and is familiar with the fact that we often will have group work assignments in addition to those individual ones.
So a lot of people having questions from different backgrounds. I think we see this as a theme, and people, please put in your background so that we know, all the different backgrounds we're getting people that are interested in this field from. And we know from the poll as well that there's a few people that are have no background in the field, right? So maybe all of you can touch a little bit about the transition from different backgrounds into the health informatics. We were seeing, like, from bachelors of science, bachelors of business administration, and then yeah, those are the two so far. But yeah, that's something that we always see. So if we could all touch a little bit on that.
Sure. Abbas, do you want to start?
Yeah, yeah,
Yeah.
sure. So usually because I'm doing some workshops to introduction to digital health for new immigrants, IMGs. So usually I present a roadmap in this industry that in any of these steps for developing a solution in the healthcare system, develop it, adopt it, implement it, delivery, in all of those steps, we need different people with different skills and background. Technical back people, we need them for develop our solutions, coding, programming, developing our technology. Then we need some people for project management, business analyst, or change management. They need to how adopt and implement this solution in a healthcare system. Then we want to gather this information. Then we need data analyst for storytelling, presentation, all of those other skills we need at that moment. Then for delivery, for research, quality improvement, privacy, security. It's a big environment. And for any of this specific environment, we need different people with different background. And health informatics or digital health, any courses, specifically the TMU one, I choose TMU one because I found it unique in comparison with others because it provides you a list of different courses. You can pick based on your background, based on your interests, and adjust it with your vision and your future plan. Prepare yourself to join to this environment. So for that reason, anybody, if you like this new environment, growing environment, you just need to investigate more about this field, and this program is a good one to lead you in that way. And then just find your location, which area you wanna jump in this industry, then that would be a welcoming environment.
That's a really good answer. Thank you. Thank you so much for that, Buzz. Okay, so next question, and maybe all of you can touch on this as well, is about AI, about the implications of AI in the industry, how much of that is being covered in the course, and what the impact looks like for jobs and things like that. So maybe Lisa, you can start with this, and then Abbas and Priya can join in.
Thanks so much. So anybody who's ever heard me talk about AI, I do talk about it a lot. They'll hear me say it's only as good as the humans that are operating it. It is just a tool. It's not going to replace people. If it does, we're in bigger trouble than just losing our job for sure. So keep that in mind. What we do here quite often, though, is that the only people that will be replaced by AI are those that don't embrace it. So learn how to use the tools, learn how to make sure that you're using them properly, ethically, effectively. All of those things, they really are just tools to make you work more efficiently. And we really need to start thinking about them in terms of a tool as opposed to a fix all for everything. One of the things we really need is legislation. So, in the absence of legislation, we really have to rely on people who are really well trained, both from how to use the tools as well as how to use them ethically. So, I think those are some really important considerations as you're working through deciding whether or not this is something you'd be interested in. But really, that focus on ethics is where I like to see that be a real important thing for people to focus on.
Love it. Thank you. Thanks for sharing that. Priya or Abbas, you want to chime in?
Priya, you
Well,
want to go first?
yeah, well, actually, I was just going to hand it over to you that we understand the implications of AI. It's been embedded in one of our foundations courses for quite some time, and also in our just general healthcare systems foundations course as well, too. But with the recognition of the, rapid growth, we are currently developing a AI and healthcare course so that students can delve into all of the domains and subdomains of and relevance of AI across the entire sector, both from the management aspects and those specifically related to informatics. And Abbas is our developer for that course. So I think it's a good segue to introducing you. There you go.
Yeah, thanks. Yeah, for now, but Priya has a better recommendation on which courses touching AI, but the fundamental of health informatics that I'm teaching, I have a specific modules about AI, but that's brief. And thanks to Priya with her great vision, he got the approval for this new course, and I'm working on that. So that would be a full course about AI in healthcare from different perspective. Fundamental is not very advanced one. It's a fundamental. Everybody, if they are interested in AI in healthcare, they can attend or register for this course. So definitely, this is our again the future of digital health or health informatics. And we are every day you will learn about new features, new functions, new solution in AI. We have lots of issues and problem in healthcare system, and AI is a promising solution to help us to resolve some of those problems, but there are lots of concern about it, and all we are learning about it, how past this concern, and we have improved a lot in last 2 years. So there are lots of learning about AI, and you will learn about it when you join us.
Sure, we can look forward to that new course. Thank you. Thanks for sharing that. The next question is, does it cover preparation content for the CPH, IMS, CA, or any other certification exams?
Yes, that one I can answer wholeheartedly. It is, it will require, sorry, it will give you the requisite knowledge that you need to be able to sit for certification, assuming that you also meet the other criteria that's outlined by digital health, which is related to experience. But in terms of the educational component, we meet it. And I think the other thing that I just want to make a plug for Chima as well too, all of our courses, and I will let Lisa definitely speak to this more fully, but all of our courses have been accredited as well. And so there are pathways that Chima also creates for students to take the learning from the certificate and move that into further designations associated with Chima. So that's a pathway that, you know, with additional learning, students will have access to as well too, to be to that particular certification. So we're thankful that that just maybe happened in the last year. And so that has also been a huge benefit to our certificate.
Yeah, love when those things come together. Thank you for sharing that. And I know with that, Abbas has to leave because he is teaching a course as well. So he has to start the class for that. But it was great having him. Thank you again, Abbas, for joining. Okay, so we will continue with the questions. I know I asked people to let us know what other backgrounds they're coming from, and we're seeing a lot of registered nurses, healthcare background, and also IT. But we have someone asking, what level of IT systems is required for the course, and what level of IT systems are being taught.
Sorry, can you just repeat that? You mean what level of IT systems are being, okay. So are we
Yeah.
talking about from the foundations? Because students are going to learn a lot about the foundational knowledge about various different IT systems, particularly where do we house data? How, like, what does that structure look like from, the regional level to the provincial level to the national level? And so it's really learning about those data repositories, what they're holding, why that information is being captured. In terms of IT systems, a boss would have been, far better to be able to speak to this, but you are going to learn about various different software for sure that is being used in the field. And then you're also going to go through sort of the applications associated with those various different tools, so or applications. So in terms of IT, I guess that those are all, I mean, IT related
Yeah, for sure.
things
One
that
thing
you're
I
going to be
know
exposed to. I
for
don't know if
sure
Lisa
is
wants to chime in and say anything.
I know that there's definitely concepts of including and how to store and structure the health records in electronically. So
Oh,
all
for
systems
sure.
use that.
And even
I
even
know for
tools that are
sure is
used. Yeah, and even tools that are used. So Folio, like students are going to, we have a coding course as well too, that they're going to get actual, like really, really close familiarity with using the tools that are used in the space of health information management for sure. So yeah, so there's a ton of different types of software that they are going to use and become familiar with.
I'll just add some of the courses that are included in the certificate were also courses I did through my program. And there is a lot of things like messaging languages, SNOMED CT, HL7, the DICOM, all of those things as well, which is really important to know for interoperability. So there's definitely various levels. I'm not sure that you would have to know how to deal with regular IT type of things, but you do have to obviously have an understanding of the technology and those things. So
I love all the different backgrounds that are coming in now. We've got someone from Bachelor's of Psychology, someone who is a new immigrant with previous experience in clinical work and a master's in science degrees. So it just really shows the broad array of interest that this certificate gets, which is amazing. Oh, someone from international pharmacy and uh, and also permanent resident here, not a background in tech. So, we've shared that you don't really need that big background. You can always come in and learn whatever tools are being shared within the course.
Yeah, and I think it's important to just be cognizant of the fact that if your field collects data, specifically health data, is going to be an informatics component. So whether that be pharmacy, psychology, there are different types of metrics that are gathered for every single field that's clinical or clinical aligned. And all of them are going to have repositories of data that potentially with, the right type of analysis will support decision making that's well informed by that data. And so, the principles the same will be restricted to various different types of data in a hospital setting than other types of data in the community. And then there's some crossover and connecting data. But in all instances, you can think about the field as where you're using this type of data to inform decision making in those various different spaces. And so that's why I say these people with these backgrounds would also be using data for the purposes of decision making in their respective fields. And it would be a transition that would be, pretty natural. It's just getting used to the various different data and, limitations of that data within those areas. So.
Great. Can you share a little bit about the coursework or the exams and the practicum? How does that work?
So there's no practicum in our certificates. Those practicum opportunities would come by way of students using the certificate courses to ladder towards the Bachelor's of Health Administration program at a later point. So there's no practicum. So with respect to the exams, every exam is taken online so that students can take them in the places that they are. They're typically released for a period of time. Sometimes that's 2 days, sometimes it's an afternoon, sometimes it's as much as a week. And then students are able to access those exams, go in and write them when they can. There are assignments, tests, quizzes, like every other type of course that you would take, also in the certificate. And all of those things students will complete virtually and be able to submit using our drop boxes. So everything is intended to be done from where you are and where you take your course, essentially. So, yeah. So, and there are synchronous components, like I said, and asynchronous components as well. So, yeah.
So yeah, we keep getting all the different backgrounds that people are coming from. That has been a recurring theme for today. And I think what most people want to know is, with this different background that I have, is this certificate going to take me to that next step? Will I be able to present myself better in the job market, or if I am transitioning as a newcomer into the industry, is this going to help me, with whatever background that I have, whether it's an MBBS background or a medical admin background or a psychology, pharmacy, medical lab setting background. So if you can maybe talk a little bit about which of the backgrounds, or if there are some are important or not, and how does that help them to get to that next step?
Lisa, do you want to speak about the health information management area? And I mean, and the transition to health informatics, and then I can hit with the pharmacy and all these other areas of background. So.
Sure, yeah. So within both health information management and health informatics, having that broad background really does help with helping you understand. As Priya said, data is collected everywhere, and in some cases, it's collected in really clear informatics type ways. So the lab folks that are on the line, your lab information is collected regularly. It's put in through the machines that do the tests, and then all of that information is then turned into data that gets shared. So if you're working in the lab, you're already familiar with informatics. You're probably just not putting it into that word necessarily. But so you already have an understanding of how lab tests are completed, all of those things, and you can then use that knowledge to help you translate it into how to understand the data and how to work with the data. So there's definitely synergies across both informatics and health information when you're talking about all of these varying backgrounds. Everybody brings different perspectives. Some of the keenest people that I've ever worked with that were really, really powerful have a health informatics or health information background paired with business analytics, that business analysis mindset. That is so powerful. Same with project management folks. So there's really no background out there that I would say couldn't benefit if health information is something you're interested in.
Yeah, I echo that sentiment for sure. Like I had said earlier, that if you're coming from the pharmacy sector, if you're coming in the world of psychology, community health, there are so many areas where there is a type of informatics, even the dental world, because they're also using, their data that they're collecting for decision-making purposes. So essentially, everybody from all of these different sectors, largely clinically, you know, inclined, would definitely be able to transition into this particular field of health informatics with very little issue. And if anything, it's learning about the different types of data, how that data is collected, how it's secured, all the ethical issues, the tools that we use around that data collection. So you're transitioning a skill set that you have in your fields, but you'll see that there's quite a significant amount of alignment with other areas like health informatics from where you're coming from. So there's really no field that I would say you would be prohibited because, as a boss also mentioned, it depends on where you would come in that decision-making line, because all people with all backgrounds at some point, even at the point of dissemination, would have relevance in this area. So, and be able to find, their space to thrive.
Yeah, and I think that that also sort of goes into the next question, which is, what are some of the most important skills to be successful in this program and eventually in the job force? So I think a lot of this is something that you also come with when you're starting, and then obviously there are all these transferable skills that you develop throughout the course as well. But yeah, if you want to elaborate anything on that.
Yeah, data analytics is definitely a space, like that is definitely a skill that either you're going to come with or you're going to advance. The good thing about our certificate, which Abbas alluded to, was that you can choose various areas of specialization, whether that be human resources, because that's an area that you're interested in. It could be management because you come with the analytics background. It could be advanced data analysis because you don't come with the analytics background. It could be that you're coming out of the sector, you have you have data analytics advanced, you're coming from the banking sector and you're transitioning. So you're going to want to use electives that tell you about the field of healthcare. Sorry, is
Yeah.
that me making that? Yeah. So it's all these different areas that will have relevance essentially.
Awesome. Thank you. Thanks for sharing that. And maybe Lisa, you can start with this one. Can you provide a practical example of a supply chain challenge in the healthcare environment where healthcare informatics was used or was useful in finding a solution?
Well, that's quite the question. Well, yeah, I mean, maybe not necessarily supply chain related, but the COVID-19 pandemic, absolutely, we saw enormous reliance on health informatics, using that information, finding ways to share that information to actually get to where we needed to provide healthcare, where decisions were being made, all of those things. So we definitely saw a huge advancement, and you're continuing to see the fallout from that, where we're working through legislation like Connected Care for Canadians, Bill S5. That's really going to drive vendors making sure that they're removing data blocking from their systems, allowing information to be shared more freely. It's those types of things. So there's tons of examples, I'm sure. Priya, I'm not sure if you've got anything you want to add there, but that was definitely the one that popped up for me, was just the advancement that we saw through COVID-19 for sure.
Yeah, and actually, that was a really good example of how we built the systems because we recognized that we weren't tracking the right things. And actually, where we saw a lot of interdisciplinary connections because epidemiology came in and the epidemiologists were also working with the healthcare managers. And so there was quite a lot of crossover that we did an interdisciplinary collaboration that we wouldn't normally see because people were very siloed prior to that period. You were hospital, you were hospital. You might have been hospital specific or connected to a larger chain because you're part of a hospital network, but we did not see this collaboration because there was no necessity for it. And then the pandemic
Right.
hit and we had limitations and access constraints. And then it was busy trying to build the systems to reflect both, our procurement, which that directly, tied into supply chain, and you could see the supply chain
Sure.
blockages issues, and then our use essentially. So then it was like how many people were getting vaccinations and what regions and where were we failing and where were we strong, and public health had to come in. And so like everybody started to have to work together. So you saw a huge interconnection network that formed that we never had before.
Sure.
Oh, that's a great example. Thank you. Thanks for sharing that. We just have one last question. Does the course cover Internet of Medical Things? So I'm not sure about that term, but if you know if there is anything where the course covers Internet of Medical Things.
I recall definitely the IoT, so the Internet of Things, which is your smartphones, your watches, your all of those things that are smart. When in terms of the medical things, that gets into more things like maybe infusion pumps, the insulin pumps that are used, they're considered the internet connected. Those DICOM readings that you get for managing your insulin, those types of things. Some of the more advanced technology that's out there, like things that are done for pacemakers and all of those things. So there, it does touch on it. Obviously, this is a field that changes rapidly, especially with AI. So again, it'll be up to Priya and Abbas to make sure that they're keeping up to date on those things. But I definitely recall at least a couple of courses where it's
That's right.
referenced. So
Yeah, so our foundations courses in both the informatics foundations course, the health systems course, they're covered as well as this AI course that is currently under development. You'll also see a bit of this covered in our coding course, just from the application standpoint. And you will also see it in the human computer interface course as well, too. So there are several courses and elective options that students can take that will, give them more information in these areas. So,
Awesome. Thank you to both of you and also to Abbas previously for joining us, sharing your insights and sharing your knowledge. So we don't have any open questions right now, and we'll start to wrap up. I want to thank everyone that attended our session and all of the great dialogue and questions that you asked. Thank you to Raymond and Abby for answering all the admin questions in the background, for Luke for making sure everything runs smoothly. If you're interested in learning more about this website, this certificate, please visit our website at continuing.torontomu.ca. And I've posted my email address, but you can always contact me directly at mash.chaudhry@torontomu.ca for any questions regarding enrollment or admissions or any of the courses or anything else that you want to know. Everything that we shared will be sent to you in a recording, as well as a survey within the next 24 to 48 hours in a follow-up email. And on behalf of the Chang School and our presenters, thank you for joining us today. Have a great rest of your day.
Folks.
Bye, everyone.